I get really sad when I see an elderly patient and they tell me, I don't usually tell my doctor about my pain because it's just part of being old. Or I don't want to ask my doctor for pain treatments because they will tell me it's all caused by arthritis and they will prescribe me strong painkillers. Or when they say, I know there is nothing to control my pain, so I just endure it. These statements are all wrong. These are all myths that people believe. And I know many doctors also believe these myths. Today I'm going to talk about pain in older adults. And I will debunk some myths about chronic pain in seniors. And I hope to leave you with a better, more optimistic viewpoint that older adults do not need to be stoic. Stoic is a person who can endure pain or hardship without showing their feelings or complaining. Let's talk about pain in older adults today. I have a copy of this book, co-written and co-edited by my colleague, Dr. Thomas Hadjistavopoulos, from the University of Regina in Canada. You can find the link to purchase this book on the description of this video below. On page 9 of this book, he writes about myths that people believe regarding pain in older adults. Myth number 1. Experiencing pain is a natural part of growing old. The fact is that although pain accompanies many illnesses that affect older people, like osteoarthritis or cancer, it's not the result of old age, but a consequence of diseases, illnesses, or injuries that need to be treated or managed. If we think of pain as a natural part of being old, we may be less inclined to treat it effectively. Persistent pain needs to be managed, regardless of a person's age. Myth number 2. Older adults suffer less than younger persons when they have pain problems. The fact is that older adults are likely to be affected by pain as much as younger persons. Myth number 3. I don't have the right to ask questions about my pain. Well, the fact is that you have the right to information regarding your pain and its proper treatment. You can discuss various treatment options with your physician. Myth number 4. Older adults can't tolerate strong painkillers. The fact is that opioids or narcotic painkillers such as hydromorphone, oxycodone, they can be appropriately prescribed. They can be appropriate medications depending on an older person's condition. Myth number 5. Analgesic pills or painkillers are the only means of treating pain. Well, the fact is that taking analgesic pills is not the only strategy for pain treatment. I'll talk more about this later in this video. There are many options, some of which are even better than pills. The truth is that pain affects more than 50% of older adults, and many doctors and nurses are not properly trained to assess pain, to ask the right questions, and they don't receive enough training on how to treat pain in older adults. Many clinicians do not feel competent to tackle the problem, and they have discomfort asking questions as they don't know what to do with the answers. So, older adults avoid talking about their pain, and healthcare professionals avoid asking about it. But pain does not go away just because you don't talk about it. Actually, if you don't confront pain sooner, the problem gets worse with time. For example, a back pain that is not treated early may cause the person to avoid walking and become sedentary. Then osteoporosis hits and gets worse, and then the person may have a fractured bone, aggravating the pain even more. Before I move on, let me remind you that this video is for educational purposes only. For any individual diagnosis and treatment, please talk to your doctor. And if you have an emergency, go to the nearest emergency department close to your home or call 911. I know that seniors have many health issues to discuss with their doctors, and they have many health concerns that they want to get treatment for, like heart problems, cancer, or dementia. But pain is also a serious issue that must be brought up at the doctor's appointment. When pain is poorly assessed and treated, it leads to poor quality of life, physical and emotional suffering, and pain is a complex experience. It involves not only the body, but also the emotions, sleep, mood, and enjoyment of life. Because pain affects so many areas in our lives, we recommend a multidimensional treatment of pain. I explain this as the 5MIS for the treatment of chronic pain. People with chronic pain need to have many tools in their toolbox and learn when and how to reach each tool effectively. Pills or medications are only one of the tools that we have in the toolbox. That's the first M. There are various types of medications that we use for pain. I explain anti-inflammatory drugs in another video. There are other types of pills that are like vitamins and supplements. I recommend vitamin D supplements to almost all of my patients. And you may watch another video that I made about vitamin D. There are other supplements also that are indicated for some kinds of pain. You may watch my other video about magnesium, vitamin B12, curcumin, coenzyme Q10, omega-3, glucosamine, and chondroitin. There are other types of pain pills that we can use too. These are the opioid analgesics and some medications that are in the anti-epileptic, anticonvulsant class of medications, others that are in the antidepressant class of medications that we can also use to treat chronic pain. The second M is for mind-body therapies. I explain in another video that these interventions are extremely important to fix the pain system. If the pain system is overactive, the volume of pain is increased, and these mind-body therapies will work on reducing the pain volume and pain memory. It's interesting that the majority of older adults with chronic pain do not seek treatment with psychologists. One of the very effective types of psychological interventions is called cognitive behavior therapy, CBT. This kind of therapy works very well for pain in any age group. The third M is for movement. Exercise is essential in the treatment of chronic pain. Actually, there is a lot of high-quality evidence from scientific studies that the benefits of exercises are equal or bigger than medications or drugs or pills. And not only that, but they last longer. If you take a pill, a painkiller, the effect is usually a couple of hours. But if you exercise, initially your muscles may hurt a bit. That's normal and that's okay. But then the benefits of the exercises will last days, weeks, or months. I have a couple of videos about exercises on my channel. And if you read the comments on these videos, you will see for yourself that exercises work for a variety of pain conditions, like osteoarthritis, tendinitis, bursitis, plantar fasciitis, lumbar disc disease, sciatica, spinal stenosis, and myofascial pain. One of my videos of exercises for hip and knee osteoarthritis has more than 2.5 million views and more than 3,000 comments. Here is a comment posted by Teresa Ciolin on my channel. Thank you so much for providing these exercises for osteoarthritis. After 3 days of doing your exercises, I already feel much less pain and have more range of motion for my hips. I'm very grateful to you and I would recommend you. God bless you and all your work for people suffering pain. Another video of exercises for shoulder pain that I did has more than 1.5 million views and more than 1,600 comments. And here is a comment posted by Jean Jenkins. These exercises are excellent for my shoulder problem. I suffer with rotator cuff tear. They have improved the mobility of my shoulder. Thank you, Dr. Furlan. I have many other videos on my channel, so please press the subscribe button now and the notifications to receive alerts when I post new videos here. Well, the fourth M is for modalities. This can be physical modalities such as heat, ice pack, acupuncture, laser, or electrotherapies like TENS. The fifth M is for manual therapies, and there are therapies like massage, manipulation, mobilization. The I is for injections or interventional pain procedures, and this includes steroid injections, trigger point injections, or nerve blocks. And the S is for surgery. This could be a joint replacement like a knee or hip replacement or arthroplasty, or even more advanced therapies like the implant of a spinal cord stimulator. So in summary, if you are a senior who is suffering from chronic, ongoing, persistent pain, talk to your doctor. If your doctor does not have the resources to help you, ask to be referred to a multidisciplinary pain clinic. That is a clinic with a variety of professionals that could include nurses, social workers, psychologists, physiotherapists, occupational therapists, pharmacists, and many other professionals. Pain is not a natural part of getting old. When a child has pain, the parents will do anything possible to find the cause and treatment for their child's suffering. It should not be different just because you are a senior. We have so many strategies to reduce pain, not only pills. That is unfair to seniors not to have access to these interventions just because of their age. Oh, and before I forget, you can download a document that contains the script of this video. Go to the description of this video below and click on the link. Thank you for watching. Goodbye.